All right, good morning, everyone. We are in a different setting today here for Facebook Live, but this is still your opportunity to get your COVID questions answered. A little bit of technical changes today, a lot of things happening across the city. And so I am actually in my office, but we'll still be taking your questions directly. Dr. Allison Iwerty, Commissioner at the Chicago Department of Public Health. Today is Tuesday, January 19. And as always, you can put your COVID questions directly into the box below on Facebook. You can also use the hashtag #AskDrArwity on either Facebook or Twitter. We're going to have opportunity to get to your questions, but there is so much going on that I actually want to take a few minutes first to give you an update, both about vaccine planning and a little bit about the mitigation. You may have heard that Chicago has met the metrics and is now able to move and loosen some of the restrictions, and I want to make sure people understand that, and we'll get to questions. So there's a lot to cover today. I think let's quickly start with the dashboard. So I'm going to just bring up and hopefully share my screen here. And we're able to see the dashboard. So as always, you get here by going to chi.gov/COVID- or chicago.gov/coronavirus and right up at the top, latest data. So if we look, first, you can see all of these numbers here are green, which is a good sign. We're down to 953 new confirmed cases per day. You can see that's down 9% from a week ago. And if we look at our graph here, you can see that just like, we came down and then post-Thanksgiving, we went up again, came down. Here's Christmas, New Year's, end of year holidays, poked back down, came up, and we are now coming back down nicely. Our low point on cases was December 25th. It was actually our low point also for positivity, but this is very good progress. Similarly, our testing numbers are up about 7% from a week ago. Our deaths are down. We're averaging 12 per day, still up a lot from the 2 to 4 that we were averaging over the summer, but heading very much the right direction. And then our positivity is down now to just over 8%. This is going to continue to change a little bit over the next few days. But the reason we've been pleased to see that progress, you can see just a week ago, we were at 10.3%, is that this positivity is one of the metrics that we're following to be able to potentially move out of the state mitigation. So effective yesterday, Chicago had made enough progress as a region to be able to move into what is called in Illinois Tier 2 mitigation measures. And I know it can be confusing for people with all the different tiers and the numbers, but let me explain to you what that means. So at the state level, there have been different tiers of mitigation. The whole state has been in Tier 3 mitigation, which is where indoor dining is closed, restaurants are closed, lots of things across the city and the state have been closed. And then as we have been seeing progress, different regions have been able to start moving backwards, meaning in a good way on those mitigations. So to move from phase 3 into from Tier 3 into Tier 2 on the state mitigation, we had to be averaging under 12% positivity, which clearly we are. We had to have adequate hospital capacity, ICU capacity over 20%, which we are very easily meeting. We're over 25% there. There had been some conversation about whether the non-hospital capacity needed to be included, and the state has made a decision that does not need to be included at this point, which we fully agree with, because you do need to also see your number of COVID cases that are hospitalized going down. So here in Chicago, our number of COVID cases in the hospital going down well, our ICU capacity adequate, and our positivity had come down. And so really, as of now, still in restaurants and bars, there is no indoor service that's allowed. The next tier, which we may possibly be able to move toward as early as, possibly over the weekend, early next week, depending where this number goes, we need to be averaging under 8% consistently. And that's as the state calculates it. So we're still a few days, it could be a week away from this, but if progress continues in the right way, I think it is likely that we may be able to move all the way to the tier 1 mitigation, which is when we are able to reopen indoor dining with a lot of restrictions on it, 25% capacity, only 4 people at a table, et cetera. So we're not there yet, but I want you to know that the way the numbers are heading, I am feeling very optimistic that hopefully within just a short period of time here, Chicago will be able to move ahead. But good news is that already with the progress that we've made, although there's no indoor service allowed at restaurants, indoor events of 10 people or fewer are allowed to resume if food is served and their locations that are used for private events like banquet halls, etc. Obviously, face coverings have to be used. Tables have to be 6 feet apart. You can go online to find out more of the details. Also, health and fitness centers can be open at 25% capacity indoors. Group classes of 10 or fewer can resume under that 25% capacity. You no longer are required to have the reservations, and locker rooms can reopen. Movie theaters and performance venues can reopen indoors at 40% capacity with no more than 50 people in any space. Museums can open at 25% indoor capacity, and there's some more details about guided tours and groups. Personal services like spa type settings can be open at a 40% capacity, but you need to have the face coverings only removed for services that require their removal. Indoor recreation can open at 25% capacity. And again, in each of these spaces, there is some more detail available online. And then places of worship are open at 40% capacity with no more than 50 people in any open space. Event venues, indoor and outdoor, can resume, but with no more than 10 people. So you can go to chicago.gov/reopening to read a lot more details about this. The Business Affairs and Consumer Protection will also be holding a webinar on these new mitigation measures. Where are we now? Again, these are set by the state. It's set for this Thursday at 2:00 p.m. You can go to chicago.gov/businesseducation to be able to learn more about that. So I hope that is giving you a little bit of clarity. We're making really good progress in our numbers. That is turning into really good progress in terms of being able to bring back some of these services. I'm optimistic that the way things are heading, hopefully quite soon, we'll be able to get into tier 1 mitigation, which would start to open in a limited way that indoor dining. So please, I refer you to the website where you have additional details. But that is one, I hope, really good piece of news. I want to highlight that it is important as we look ahead to this potential careful reopening that we do not let our guard down related to the mask wearing, the social distancing. This does not mean at all that we are past COVID. And you'll note, I did not tie this specifically to vaccine. We make these mitigation decisions just as we have all along based on the same metrics related to cases, positivity, hospital capacity, and we are meeting those metrics. And so I am pleased to see this progress. But I do want to note that we know, for example, that you may have seen the news last week that we did detect here in Chicago our first example of the newer UK variant. It was in a traveler, and we've done all of the appropriate contact tracing and ensured that contacts here are doing the right things related to quarantine and testing. But we do anticipate these variants to spread. We're seeing them pop up across the country, around the world, and where those are somewhat more infectious, it means we need to be, even more careful as we move toward reopening. So I'm comfortable with the way that we're heading. I'm pleased with the progress, but it does not mean that this is a free for all and that COVID is over. So it is going to be balancing that. The other thing that I wanted to really highlight before we get into your questions is some more detail about where we are in terms of vaccine planning. So I'm going to pull up a PowerPoint here as well. People are able to see this. Yes. Okay. So When can you get a COVID-19 vaccine in Chicago? This is the question we're getting over and over again. And I do, first of all, want to be very clear that any dates we provide are purely speculative based on how much vaccine we get. Right now here in Chicago, we're getting 34,000 approximately first doses of COVID per week. And that is not even enough to be able to vaccinate 5% of the people who are going to be eligible in phase 1B. So right from the beginning, I want people to hear that even as the phase opens up, most people will not be able to get vaccine right away that first week, even that second week, et cetera. But I want to talk you through some of what we're planning high level. So as you know, we have been in phase 1A, and this is vaccination phase 1A. This is the same language that's being used around the country. And in phase 1A, that includes our healthcare workers, our long-term care facility residents and staff. We are formally moving to phase 1B this coming Monday, really with the rest of the state, beginning January 25th. As we move to phase 1B, that includes frontline essential workers, non-healthcare residential settings, and then, the big move is to formally open to Chicagoans age 65 and older. This week, we have been allowing our medical facilities that are vaccinating, they all, we have literally thousands and thousands and thousands of outpatient healthcare workers who have appointments and are getting vaccinated all over the city this week, at hospitals, at pharmacies, at our points of dispensing at clinics. But where there was any additional vaccine available, we have allowed, we obviously want to make sure vaccine is being used. That is everybody's goal. No vaccine has been wasted. No vaccine will be wasted. But we have started to allow, kind of in this transition period, any of these hospitals or clinics with additional doses to start reaching out to their own patients who are older that are at highest risk. But beginning January 25th, formally, we will be open in this phase, and we'll be sharing more information a little bit later in the week. We will have the ability for people to sign up for appointments, but the appointments are going to, again, to be quite limited. And Chai COVID Coach is your place if you want to make sure you're not missing the opportunity to get information as appointments are available. Looking ahead to 1C, we have put a date on it just to have something where people can understand what we're thinking. We're tentatively thinking the very end of March 29th is when we may open to all other essential workers, as well as Chicagoans age 16 to 64 with underlying medical conditions. Again, I want to make very clear that date is totally dependent on how much vaccine we get, what changes we may see with the federal government. But broadly, we're thinking phase 1B will be working through these groups over about 2 months, and then opening beyond that. And then looking ahead to phase 2, which is really when vaccine is available to all Chicagoans, we're tentatively saying that might begin May 31st, the end of May. All of these numbers for phase 1C and phase 2 subject to change, but just to give people a high level sense of what we're thinking. And then let's talk in some more detail. These will be posted on the website. You'll have the opportunity to review them, and you'll be hearing a lot more about them. But there are two main goals, and you've heard me talk about this as we do our phased rollout of COVID vaccine in Chicago. So on the left here, our goal is to prevent COVID-19 hospitalizations and deaths. The phase opens to the whole group at all times, but then we make efforts to prioritize by COVID-19 risk in the order that's below. Most of the groups in the left here, to date, long-term care and other residential healthcare facilities, but as we look ahead to 1B, Chicagoans age 65 and older and non-healthcare residential settings. Most folks in this group are going to be vaccinated in either those residential or in healthcare settings, clinics, hospitals, pharmacies. On the right, we set our goal of preserving the services that are essential to functioning of society and preventing outbreaks. Again, the phase opens to the whole group with efforts on the city side to prioritize by COVID risk and lower barriers in the order below. Many of these people will be vaccinated in employer-based settings. So you can see in 1A, healthcare workers here broadly were able to get vaccine through their hospital or through their clinic, but where people are working in home health or dental offices or laboratories, et cetera, we've worked to set them up with appointments, and there will be similar approach as we move into 1B. So let's talk about 1B. Again, we're beginning on January 25th. We expect most people in this group to be vaccinated in February and March. Anybody who did not already get vaccinated but was called out in 1A continues to be eligible for vaccine. We continue to push vaccine to these long-term care facilities. We continue to work with our hospital partners to offer vaccine to their workers, et cetera. But the way this will broadly roll out is that over the months of February and March, anybody who is in either 65 or these frontline essential workers is eligible for vaccine. And so, for example, if I am a grocery store worker, or I am a teacher, or I work in public transit, and I have an appointment with my doctor, for example, my doctor absolutely can give me vaccine at any point after January 25th. But we will also be working to bring vaccine to employers, to partner with employers, to lower the barriers for these groups to get vaccine. And let me talk you through how some of that is going to really lay out here. So as we move into 1B, the last week of January and the first week of February, we'll be directing vaccine through employers to correctional facilities and first responders. This has already been in the works because we've been vaccinating healthcare workers in those settings, whether those are the emergency medical service people on the ambulances, whether those are the people in the correctional settings who do healthcare. So the plans are in place, and additionally, more workers will come online. These are the settings where we've seen the most COVID cases, the most outbreaks. Every case that we prevent in these settings indirectly prevents many other cases, gets us past COVID, lowers the risk when people are going back to communities. Really essential to be getting those workers vaccinated. And then over the month of February, really depending on vaccine availability again, we'll be working to make vaccine available through employers to grocery store workers and manufacturing and factory settings that have had outbreaks. Again, these are places where we've seen larger outbreaks, more people, again, who work in Chicago's hardest hit communities. Pushing vaccine here has that multiplier effect in terms of preventing additional cases, bringing down COVID case rates in Chicago. That lets us more quickly bring COVID under control as a city, reopen society while we work on vaccine. And then obviously in February, we'll be directing vaccine through employers to the daycares, the K through 12, the early childhood educators. Private, parochial, public, doesn't matter. All educators are going to be prioritized with planning a little bit later in February, and that is well underway. Right now, for example, healthcare workers, school nurses, et cetera, are all being vaccinated who work in these settings. They, in turn, will be doing a lot of the vaccinating for staff. It's a big effort. It's the biggest group within that frontline essential workers, and we're very committed to starting with this group in February. But I want to be clear, there is not enough vaccine, right, to vaccinate all of the Chicagoans age 65 and older, all of these frontline essential workers, and it will take weeks to get these groups vaccinated. But we'll be starting the change, pushing it through as we go. And then really over the month of March, again, depending on vaccine availability, we'll be directing vaccine through employers to public transit, other manufacturing, agriculture workers. We'll be pulling in some government workers, continuity of government, for example, legislators, postal workers, and you'll hear more about that. So just to sort of, I wanted you to be able to see this in one place, how this will be working. So on the left side, we continue to push, Chicagoans age 65 and older broadly will be getting vaccinated through healthcare providers. There will be opportunities to sign up for appointments, but most of this is going to be through, most ideally your own healthcare provider, your hospital you go to, your doctor's office, your pharmacy, and you'll be hearing some more details about that. CDPH is continuing to do the heavy lifting on strike teams, working with clinical and pharmacy partners, just as we have in 1A, to bring vaccine to skilled skilled nursing facilities, assisted living, we will be bringing vaccine into correctional settings, into homeless shelters, into other residential settings that have had local outbreaks. So I hope that helps clarify for you some of the planning here. 1C, looking ahead, is when we'll get to younger people with underlying medical conditions and all other essential workers. And then phase 2, again, really mostly starting at, we're planning potentially at the end of May, would be open to everybody with the exception of younger children. As vaccine is authorized for younger children, they would then be added into the plan. I don't anticipate vaccine being authorized for younger children until the summer at the earliest, and certainly we'll share more. And so the last slide I wanted to share, again, where we've been getting a lot of questions, the city of Chicago receives vaccine supply, and we have the ability to direct that supply every week. So we are able to direct sort of what we call direct delivery in blue here, where we are directing vaccine to hospitals, to pharmacies, and to healthcare providers. They in turn are vaccinating, they have been vaccinating outpatient healthcare workers, long-term care facilities, et cetera. Moving ahead, it'll be a combination, and the hospitals, some of them may do strike teams. There's different places that play out here, but just to give you a sense, these partners will be doing seniors, they'll be doing strike teams, they'll be doing employer clinics. Providers will be partnering on seniors, potentially with school systems, but this is where there's direct delivery and we work with partners. And then in red is where we have city operated sites. So city operated sites include our pods, our points of dispensing. People sometimes call it a mass vaccination center, although a true mass vaccination center might have thousands, and that may be something that we do down the line. But right now, these are, for example, the settings that are open at our city colleges, with more opening every week, appointments available. We have a public safety point of dispensing that has been operating, that's closed, it's not open to the public. It will be vaccinating these first responders. We have mobile points of dispensing where we can move to a particular area that needs vaccine, an employer, for example. And then we have these strike teams that go into settings where it's hard for people to leave. So just wanted to walk through some of this because I was seeing some of the questions that were coming through and knew this was a lot of that. So with that, we're going to turn directly to your questions and see what is coming in here. Give me just a second to make sure we have things up. Okay. Mary Kay from Facebook. When can people with type 2 diabetes get a vaccine? So if people who are over 65 with type 2 diabetes, or who are one of those essential worker categories that have been called out frontline to jumpstart that, would be able to get a vaccine in phase 1B, potentially as soon, beginning next Monday. For people who are younger than that, not in that group, you would be eligible in phase 1C. Christine Ross from Facebook. When will gyms be able to open? So with the move just yesterday from the state level, health and fitness centers can be open at 25% capacity indoors. Group classes of 10 or fewer can resume under that 25% capacity restriction. Face coverings, masks are required at all times. In Chicago gyms, you can take them off if you're swimming independently. Other than that, you need to have them on if you're going to be exercising in a gym setting. And again, more details available at chicago.gov/reopening. Isabel Mesa Collins from Facebook. My mother is 88 years old with heart failure. She has yet to be vaccinated. When and where can she get vaccinated as soon as possible? So beginning next week, we will be opening vaccine for people just like your mother. And I didn't actually talk about this part of the prioritization. Vaccine is open broadly to anybody over the age of 65, but we have asked our healthcare providers to prioritize within their patient populations, wherever possible, people just like your mother. We've said start with your folks, ideally, who are over 75. Start with your people who have underlying health conditions. Your doctor, your hospital, they can look in your electronic health record. They know which patients are at highest risk. And so there is going to be, if your mom has heart failure, she is connected into a clinic. That means we have been working, over these last over the last month, yes, we've been working very hard to get healthcare workers, congregate settings vaccinated. As a major healthcare center, we just have many more of these healthcare workers than a lot of places do around the country. And we employ a lot of non-Chicago residents, and that's not a problem, but nearly 40% of the vaccine that Chicago has been giving has been going to non-Chicago residents. That doesn't show up in our Chicago vaccinated numbers. But it also has just meant that all of our appointments are being filled still by these outpatient healthcare workers this week. I want to be clear with that. So beginning on Monday, formally, we will be in this phase. I would first be checking with your healthcare provider. We've got about 300 now that are enrolled across the city. They are reaching out, they are making appointments for their patients, and we're enrolling more and more of these every day. In addition, we'll be sharing information about the centralized appointment system, but I want to be really clear, there's going to be very, very limited doses, just honestly through that. We're really hopeful with the change in federal administration. We have heard pledges that, first of all, they're working hard to get more vaccine, which is the biggest problem here. There's 360,000 people, like your mom, who are over the age of 65, not including the essential workers. We're getting 34,000 first doses a week. We couldn't even do 10% of the people over 65, not even including the essential work side that we need to be getting into, where we're just seeing so much COVID risk. So I would encourage, some patience, and I know that that's hard. Every week there are going to be more appointments available, and we will be doing our utmost to share where those opportunities are. Chai COVID Coach is the place if you want to make sure that you're signed up to be getting information. And then on Monday, we'll be when we formally make this announcement, we'll be sharing more information about when appointments are available, what that will look like. Aaron Sanders from Facebook: why haven't we had the same level of testing since November 22? Related, why aren't we using rapid tests, particularly at schools? Okay, so there is plenty of testing capacity actually across Chicago. And if you look at the way that graph looks on testing, it looks like you've been looking at it, which is great. We saw the absolute peak of testing here in Chicago right before Thanksgiving. And there's a couple of reasons for that. As we were heading into Thanksgiving, that was really timed with like the peak of our COVID surge. So first of all, November and into early December was the peak of our second surge here in Chicago. So by far, we have the most people with COVID. We have the most people with COVID symptoms. We have the most people with COVID exposures. A lot more demand for testing because you're in a COVID surge. Number two, people were, I think, doing a lot of testing before potentially doing some gathering with family before Thanksgiving. And thank you to the very many Chicagoans who adapted plans, did quarantines, did testing, everything to make our holidays as safe as they could be. But in that setting, that's when we saw the most vaccine available. We have not lost any of that testing capacity. In fact, we continue to grow testing capacity. We have slots available at testing around the city. But it depends on whether people are choosing to sign up to get tested. And we are using rapid tests actually in schools. So related to rapid, and it depends a little bit on the school, different schools are doing different things, but I'm guessing that the question here is related to CPS. And in that setting, so there have been rapid tests specifically made available from the federal government to use in settings like schools and jails and first responders. And, again, settings where there have been outbreaks. All along here, CDPH has been doing a lot of testing sort of behind the scenes in high-risk settings. So we go into, with partners, long-term care facilities, homeless shelters, et cetera. We're in those spaces regularly in some of the highest risk settings every single week. So we're not missing cases in long-term care. And what we've been doing in the school setting is expanding some of that testing capacity. But honestly, we don't see, where we've been doing this testing, we're not seeing at all, sort of as expected. I don't have the exact data in front of me, but like 1,000+ tests, very like a handful that are even that preliminary rapid test positive that then would need the confirmatory PCR test. So yes, testing continues to ramp up. We're also hearing from the Biden administration, they're planning to push out additional testing resources, which we're thrilled about. But that's really the answer. Judy DeFalco from Facebook. January 25th, vaccines for 65 years and older. How will it roll out? Do you need to sign up to get notified? You do not need to sign up anywhere right now to get notified. You don't have to sign up. If you would like to sign up just to make sure that you're not missing out on announcements, et cetera, I would refer you to Chi COVID Coach. And if you go to chicago.gov/coronavirus, that vaccine tab, you can also get there directly, chi.gov/COVIDVax, VAX. Right at the top is the link to sign up for that Chi COVID Coach. That's how we communicate out about testing resources. That's how we communicate out if people have symptoms and follow that historically. And it is where we are communicating out about vaccine availability. But again, most people, especially in the 65+, will be vaccinated in a clinical setting through a hospital, through your own doctor's office, potentially through a pharmacy. And there will be more to come on that as we move into phase 1B. But again, I just want to set the expectation that the amount of vaccine we're receiving is minuscule compared to what I expect the demand to be. So you've not missed anything. If you haven't signed up yet, please use Chi COVID Coach if you want to make sure you're getting direct messages. And then on Monday, as we move in, we'll share some additional details about kind of quote sign up, but there is no sign up at this point beyond Chi COVID Coach. Karen Ho from Facebook. When and how can private primary care practices obtain the vaccine to administer to patients? Great question. We are signing up private primary care practices every single day here in Chicago. So I've asked the team to, we'll be sharing online some more of the mapping of what this looks like. But we have, we started again in terms of enrolling these settings, places that were doing a lot of COVID testing and diagnosing a lot of COVID patients. That included a lot of our federally qualified health centers, but there are many private providers that are already enrolled to give vaccine. And we've been doing a lot of communicating behind the scenes to ensure that providers know what they need to do to be able to be vaccinating partners. So there is some paperwork that providers need to do. They need to do some federal paperwork. They need to sign up through the state iCares registry. But we've been enrolling really more and more providers every day. And that has been a big push of what we're doing here. During 1A, we've been building this foundation for the next wave. We want an efficient system, but we also want a system that's safe and that ensures access across Chicago. And so each of these settings have to have the appropriate storage, administration practices, reporting practices, safety monitoring, all of these things in place. So so right now they are signing up and we are pushing vaccine, even if it's a small amount, really to any of these providers that are signed up. And then as more and more sign up, we'll be able to push more and more vaccine as it becomes available. It's this network that will be our primary vaccinating partner, just as we do for flu shots. If you think about, and to Mary Delgado's question from Facebook, how about those without healthcare providers? How do they get vaccines? So this is where our pharmacies will play an important role here, as will city pods. And you'll be hearing more about some of the work that the city will be doing to bring vaccine, particularly into community areas where we are seeing lower vaccine uptake or where we know there are lower rates of people who have primary care physicians. We've mapped this across the city, so we know which areas have fewer people connected to primary care. And we've got plans in those settings specifically. And let's actually think for a second around this to the 4 ways that people will get vaccine. It's the same that we've been using for flu shots. Number 1, medical clinics. Most people will get vaccines in a medical setting. Regular doctor's office, a health center, a pharmacy, a regular doctor's office, a health center, through a hospital, through an urgent care. That is where most people will get vaccine. We've been enrolling. We got more than 200 of these enrolled, more coming online. That is where most people will get vaccinated. Number 2, pharmacies. Some people get flu shots through pharmacies. Some people will get COVID through pharmacies, and we'll be working. That's going to be appointment-based. Everything's appointment-based. You can't show up at any of these places, to be clear, in 1B to get the vaccine. But pharmacies are going to have appointments. Number 3, vaccination sites. That's the city of Chicago standing up these larger pods, and bringing it to congregate settings. And then number 4, employers. Many people get flu shots through employers. There is a more of an employer work here on this essential work front, as I described. So we're following a lot of these same models that we've used for flu. They're all going to be going on really at the same time. Amber Kirchhoff on Facebook. What underlying conditions? How do you demonstrate condition? Doctor's note, question mark. All right. So again, phase 1B is open to everybody over 65. We have asked, though, providers, and honestly, I would ask Chicagoans even, if you say you're a healthy 65-year-old, frankly, I would appreciate it if you maybe are willing to wait a few weeks and think about those who are in those older categories and have underlying conditions. But like, for example, if somebody is getting vaccinated at a point of dispensing or at a pharmacy, we are not requiring a doctor's note. We are not requiring that you prove this. We are only requiring to prove that you are over the age of 65. But one of the reasons to go through healthcare providers, your healthcare providers, they know their patient panel. They know who most needs vaccine in the people that they see. And so just let's make it very specific. Like, let's say, Esperanza Health Center, which was one of the health centers that we highlighted. They were one of the first to get vaccine, to start doing their healthcare workers. They see a lot of people. They're a big healthcare provider for their area. They can look at their medical records and say, okay, these people are the top people in my patient panel. I want to make sure get vaccine, get them in for appointments, work on it. But then similarly, if anybody is in having appointments and where they have capability, where there are people who are over 65 and may not be in that priority group, where there may be a teacher, where there may be a bus driver, where there may be these other groups, any of those folks are eligible for vaccine. And we don't require a doctor's note. We don't require that piece in this 1B stage, but we ask people to, as always, just do, if we can try to think about others, even as I'm very, I know how excited people are to get vaccine, and I love that. This is going to be a little bit of a balancing act. And again, there is just not going to be enough vaccine available for everybody. Okay. Michelle Heller from Facebook. There's a new strain. Why are we reopening more now? Yeah, thanks for that question. This has been a big point of conversation across the country. And here's what I say to that. Number one, I share your concern about this strain and all the new strains, but new strains are going to continue to emerge. All of the strains at this point, the vaccine works against them, the various vaccines, including the ones that are under investigation. And that's critical. Also, we've not seen a strain emerge that makes people sicker, which is important. There's a lot of work actually going on to understand how much some of these strains increase transmissibility. There's some animal studies, for example, where you can actually compare how likely is a particular strain to be transmitted versus another. But I do think it's likely that it's more transmissible. But what do we do about that? We double down on the things that we know work. Masking, social distancing, these things do work. We have committed to particular metrics around reopening, and I do feel strongly that those have been set based on based on what we know about risk related to science. They're based on what our situation here is in Chicago. And I do think that it is appropriate to cautiously move ahead with reopening as we're doing here. Continue to make sure that we have good monitoring in place, increase some of that genomic surveillance, which is happening, and be ready that if we see points of concern, particularly related to this new vaccine, we may need to back right off again. I know the mayor and the governor are certainly aware of this strain. I'm very aware. But right now, where we are meeting our metrics, I do think that it is appropriate to cautiously move toward reopening. But keeping in mind, reopening does not mean stop wearing your masks, start having parties. That's not what this means. And it's balancing the different factors. Getting a lot of vaccine going quickly and getting people vaccinated is the other piece that will help protect us against this strain. All right. Elena Levy on Facebook, where can unaffiliated healthcare workers get vaccine? So if you are an unaffiliated healthcare worker who has still not been set up for that vaccine, I encourage you, you are eligible. You continue to be eligible even as we move into phase 1B. Go to on chicago.gov/coronavirus, on the vaccine tab, there is a tab specifically for health workers, and somebody from your practice, I don't know what you do, should have already submitted. We've gotten more than 5,000 practices from around the city, and all of those people have been set up. We send a code. This is how it works to keep it organized. There's a code that goes that lets people sign up for appointments, either at pods, hospitals, pharmacies, et cetera. So if you're still not connected, you remain eligible in 1B, and you should get vaccine through your provider, through the pod. You'll be able to sign on as vaccine appointments are available. Okay, Megan Nee from Facebook. Why are we moving to tier 2 when positivity rate is so high? So everything related to mitigation, tier 2, tier 3, tier 1 is being set by the state. Here is what those metrics are and have been. To move from tier 3 to tier 2, you had to move less than 12% positivity. To move from tier 2 to tier 1, you had to be less than 8% positivity. So that is why we're in tier 2. We moved from below a 12, we had a 16% positivity at the peak of this surge. And so that is where the mitigation has been set. Again, I am comfortable with it. I think it's appropriately conservative while balancing all of the many factors. We're coming up on time. Let me take maybe one last question. Rebecca Flores on Facebook. Vox published an article last week recommending in-person grocery trips. I do not think they responsibly discuss socioeconomics in the article, but taking that out of the equation for a moment, will grocery stores soon be that unsafe with the new COVID strains? So I do know the article that you're referring to. It got a lot of attention. Grocery stores are one of the settings that we have prioritized, within phase 1B to make sure that we are bringing vaccine to. We know that they are essential to a functioning society, people to be able to get food, and working to make them as safe as we can is certainly one of the reasons that group has been prioritized. In addition to the fact that grocery store workers tend to live in some of our hardest hit communities, and that we have seen a lot of cases and outbreaks in that setting. I do not think that you need to be changing your grocery store behavior right now based on the strain. I would remind you, again, where possible, any opportunity to limit COVID risk, you should take. I don't want you to say that you should not take that. But going to the grocery store is clearly an essential activity. Make sure you're wearing your mask, make sure you're doing the social distancing, make sure you're washing your hands. Those things protect you against all COVID strains that we have at this point. It's really where people tend to let their guard down that we have more concern. So, this strain I know has brought concern. It's brought concern to us too, but we do need to put it in some perspective, I think. And I think, I want you limiting COVID spread opportunities wherever possible, but I also want to make sure that people, get the food that they need. So lots of balancing acts going on, lots happening. I hope that today was informative for you. We will be back on Thursday to answer more of your questions. We're getting more information posted on the website. I know there's a lot of questions about vaccine. We will be sharing additional information. Part of the reason, just to be clear, I want to make sure that there are appointments available for people to sign up for before I open up a system for signing up for appointments. Remember, this week, those appointments are all still going to our outpatient healthcare workers. And so as we move into next week, there will be some availability, but remember, most people will be vaccinated through their doctor, their hospital, and our healthcare partners are working, especially for the people over 65, to be doing that. So as we close, reminder that today, this evening, there is a nationwide moment of silence in remembrance of the lives lost to COVID-19. If you care enough about COVID-19 to be watching my Facebook live stream, that means, you have been touched. You've been paying a lot of attention to COVID. And I would encourage you to join this tonight. Residents and businesses across Chicago have been asked to turn off your lights, turn off your electronics at 6 p.m., step outside to your driveway, your balcony, outside your workplace. If you have it, you can light a candle. The idea is to observe a moment of silence for those who have lost their lives to COVID-19. That is more than 4,000 people who lived in the city of Chicago. We are at almost exactly 1 year since the city of Chicago activated for our COVID-19 response. I got the first call from CDC over Martin Luther King weekend last year. And we began a year ago. It's not a year that anybody anticipated. And although right now, certainly there's a lot of attention on the good news that, having a safe and effective vaccine, that is a game changer. I'm really pleased that we're getting, everybody's focused on this. We are too. But I do think that it's important, as we mark a moment of transition for our country as well, to think of all of the people who have lost their lives. So the city will be dark. Participating faith institutions and businesses have been asked to ring bells and other instruments to commemorate the memorial service. And then at 6:10 p.m., following 10 minutes of reflection, please turn your lights back on, symbolizing moving from darkness to light. I am extremely confident that 2021 is going to be a more light-filled year than 2020 has been. Obviously, with the inauguration tomorrow, we'll have some transitions there too. We probably will be getting some new and different information related to vaccine and additional resources for all of our efforts here in Chicago. So again, I hope that you join me at 6 p.m. tonight in that moment of silence, and that you work with us as we roll out this next phase of vaccine. I urge patience. We have good systems here. We have lots of groundwork built. We're in a good place. And I'm glad that more people want vaccine than we have it available. But it is going to take some time. And we will do everything we can to keep you in the loop, to let you know when we're having tech hurdles, which I do anticipate, seeing what this has looked like around the country, even though we've done a lot of preparation here. And we will make sure that when you get a vaccine here in Chicago, it is safe. All of the appropriate measures are in place, down to keeping track of the specific vial of vaccine that you have been given. A safe, efficient vaccine process is what's going to get us past COVID. So more to come, and I wish you a good evening. We'll be back to take more of your COVID questions Thursday at 11. Be well.